I'm going to talk about ketone esters and the application of therapeutic ketosis. I don't know how many of you are familiar with the topic, but I think it's always very actual. I'll get started with my personal story. I've been working with ketosis through the US Navy. I'm from Italy, and I'm talking to you from Italy now. But I've been for a long period abroad. I've been working in France, in England, and in the United States. Well, in my last period in the United States, I've been working with the US Navy, specifically with these guys, the Office of Naval Research, which is a special part of the Navy that basically takes care of the research behind the diving. And specifically, I've been working in a physiology lab with all these tanks, as you can see in these pictures. We used to call them the gas palace because we used to reproduce all the very deep dive from the Navy in our lab with the hyperbaric chambers. So we used to study what is called central nervous system oxygen toxicity phenomenon that led to seizures. And we have basically two ways of getting seizures out of this phenomenon. First of all, we have hyperbaric oxygen therapy, as you can see on the left picture on this slide, or diving with a rebreather. I don't know how many of you are familiar with diving, but it's actually a very fascinating science, but it can lead to serious problems. So just to quickly tell you what happens when you dive, we here on the regular pressure, we're breathing a mix called air. We have 21% oxygen, 79% nitrogen. Now the air can be easily metabolized by our body in our lungs and our tissues, but the nitrogen is an inert gas and has to be eliminated in some way. When we go down and we do not allow this nitrogen to go out, it can cause serious problems when it accumulates under the tissues. Best case scenario, it accumulates in our joints and is very painful, the best case scenario. But if it accumulates in our on our optic nerve or on our spine, it can make us blind or paralyzed. I mean, it can be very dangerous. So over the years, the Navy wanted to avoid these problems and tried to increase that amount of oxygen from 21% up to 33, 34, and at some point went up to 100%. So it could actually keep completely off the nitrogen out of the tank. In this way, there were many benefits, like they were able to stay on the bottom for a longer period of time, so the missions were much longer. They were able to go rescue people out of submarines or doing attack or defense missions, even during the war. But the side effect was that the brain was completely attacked by reactive oxygen species, free radicals that would lead to seizures. And just to give you an idea of what I'm talking about, I'm going to show you this video. It's a brief video that will tell you what happens when a seizure occurs. Now, as you can see on the left-hand side, there is a person breathing pure oxygen at almost 3 atmospheres of pressure. This is a military video. So this is just an, performance on a hyperbaric chamber, but basically mimics a real dive. As you can see, this person that is now laying down is now unconscious, and his legs are showing us a seizure, as you can see here. So this is basically an excess of oxygen in the brain. See, now he's having seizures right now. If you look at his legs, he's having seizures. Now, if this happens basically right here or in a hyperbaric chamber, no big deal, because the phenomenon will last for about 3 minutes and then the person won't remember a thing. If this happens under the water during the dive, the problem is that this can lead to death. I mean, it's easy to understand. So the Navy was pretty much concerned about this and asked us to work on how to understand this phenomenon and how to avoid it. So we started working on the neurons of the solitary complex, which is responsible of the breathing. And just to make long story short, we started working on animals, on rats, as you can see on this slide. These are spike dolly rats. We implanted these animals with radio telemetry devices, the ones that you can see on the upright on this slide. These devices were able to measure at the same time electroencephalogram, electromyogram, electrocardiogram, body temperature, and physical activity of our animals during a dive. So we wanted to identify which were the physiological parameters that would tell us that a seizure was going to happen. And just to show you, we pressurized them at 5 atmospheres of oxygen. So just to quickly show you what happens to a rat during a dive, when it's going to have seizures, this is what happens. See, it's going to sit on his back paws and have seizure right now. See, this is what a seizure looks like. He's having seizure right now. So we stop, at this point, we stop the experiment and we monitor all the physiological parameters I told you before: electroencephalogram, electromyogram, which is the basically the respiratory muscle activity, electrocardiogram, and physical activity of the rat. And what we found out, which was very interesting, was that something that we published back in 2013, that 3 to 5 minutes before the onset of seizures, the tidal volume, which is the amount of volume that the rat was breathing, and the respiratory frequency, which is the amount of times the rat would breathe per minute, would increasingly, would consistently go up, significantly go up, to tell us that a seizure was going to happen. So we found that these two parameters, tidal volume and respiratory frequency, were the two main parameters that would tell us that the seizure was going to happen. But this was not enough. We also wanted to understand how to prevent seizures to occur. So we knew that antioxidants might help us in the process, but antioxidants in these very harsh conditions might be not enough. So we thought of anti-epileptic drugs. Can you imagine giving some Navy SEALs anti-epileptic drugs just because we could think that it might have seizures under the water? This was too much because anti-epileptic drugs have a lot of side effects. So we thought of starvation ketosis or therapeutic ketosis. So the question was, do ketone esters show any anticonvulsant effects against seizures? The point is, we all know that being on a ketogenic diet might prevent seizures to happen, but putting these people on a ketogenic diet, which is a diet of very low carbohydrate amount, very high fat amount, and a regular protein amount, would actually put them under a condition of stress. And can you imagine a Navy SEALs on a war conditions, take off sugars? I mean, these people would be very stressed. So we synthesized in our lab a ketone ester, an exogenous supplement that would put our rats, and actually we tried this also on ourselves, would put us on a ketosis, very high ketosis level without being on a ketogenic diet. So let's talk about a very little what nutritional ketosis is. As we said, ketogenic diet is a very high fat, very low carb, and regular protein diet. As you can see from the diagram, there is about 75% amount of fat, 5% in carbohydrates, 20% of proteins. It is very, very difficult to sustain. So I'm just giving you here a few examples of how a ketogenic diet would be composed of. That would be fish, meat, eggs, butter, olive oil, nuts. And what level of ketosis would be optimal? Well, we start being on ketosis when we hit the 0.5 millimolar, but actually the best level of ketosis for a nutritional and therapeutic ketosis would be in between 2 and 5 millimolar, as you can see from this graph. Of course, we should never hit the the level of 8 millimolar, because that would be too much and that would lead us into ketoacidosis. But we never get to that point if our body works properly. So what are the benefits in general of keto adaptation? There's so many benefits. It is hard to get to that point, but when we get to that point, we are pretty much, I would say, invincible. We get a lot of energy, we get a lot of concentration, we have decreased central fatigue, we increase our brain metabolism, and we decrease the production of reactive oxygen species, which is why the ketogenic diet itself is very good against epilepsy, because it reduces the amount of reactive oxygen species, of free radicals. But it also increases the mitochondrial biogenesis and the insulin sensitivity. This is very important from a metabolic perspective. But you might think that the ketogenic diet and ketosis is something new. This is no new at all. Imagine that the first time the ketogenic diet was used for therapeutic purposes was back in 1922 in Los Angeles. There was this article coming out, specifically at the hospital John Hopkins in Baltimore, so on the other coast of the United States. There was a huge ward where they had a lot of little young patients affected by epilepsy, refractory epilepsy, which is the type of epilepsy that is resistant to drugs. They used to put these patients on a ketogenic diet to stop seizures and avoid all medications. And this actually worked pretty well, to the point that in 1992, this article came out. So we're talking about 100 years ago. It's not new. But if we go back to the Bible and to, a long time ago, we have some studies for 400 before Christ. We have the first studies on epilepsy. We were talking about possessed people by the demon. Aristotle actually used to talk about very untreatable people that were put on isolation for 3 days, 2 days, 3 days. Well, what happened is that after this isolation, these people were healthy. What did that really mean? That meant that what happened was that the ketosis is to kick in after 3 days of prolonged fasting. And so these possessed people were actually the epileptic people of the time, but there was no diagnosis. So even at the time, ketosis was able to control brain seizures. But if you want to have an idea, this was Hippocrates in his studies, but if you want to have a broad idea of what ketosis is about, you can read this comprehensive review from 2006 from George Cahill. I suggest you to do so. So back to our study. We gave intragastrically our rats a small dose of ketone ester to induce them into ketosis right before the diving. And what we found was that our rats were able to resist 6 times longer, almost 600% longer to the seizures than the controls. So this was actually a big paper that came out back in 2013. Well, what was really interesting was that the ketone ester induced a sustained elevation of beta-hydroxybutyrate, acetone, and acetone, which are the 3 main ketone bodies, and did not modify any glucose levels. Then I went back to Italy. I am from this area, in southern Italy. I started working with these 2 guys, Professor John and Professor Coppola, and we tested the same ketone ester, the same exogenous ketones on 2 models of epileptic rats. And we found out that in both cases, we had a consistent reduction of, actually a consistent increase against the seizures for the treated animals, which was very important. We published 2 papers about this phenomenon. So let's quickly mention what are the neuroprotective effects of ketones. We have a very good effect on weight loss. In fact, the ketogenic diet is used to lose weight for obese patients. We also have a lot of evidence on Alzheimer's disease, on Parkinson's disease, on Lou Gehrig disease, which is ALS, basically. but also on traumatic brain injury and the glioblastoma. In fact, the ketogenic diet is widely used in a lot of brain cancer studies, case studies, and also other types of cancer. But the evidence is not too much to make, ketosis the first line of therapy so far in cancer. And also epilepsy, which is very important. This is a personal case. I know this guy very well. This is one of the first patients that used to be an epileptic patient on drugs, and at the age of 34, he was diagnosed epilepsy. So he used to have medications, but then a lot of side effects too. So at some point, he decided to completely stop his medications, but his neurologist told him that he would have lived only a few months without his medications. He didn't care, but he's starting ketosis. So he's starting being on a ketogenic diet. Believe it or not, it's been not 6 months, not 8 months, not 1 year. It's been 11 years without any medications, and he's alive. So he's on a ketogenic diet and is safe. And it doesn't take any medications anymore. But let's keep going. I mean, there's so much clinical evidence. I mean, as you tap ketogenic diet on PubMed, you can find so much evidence about it. I've been collaborating with several people over the years, and I've been developing a number of dietary products that can help people stay on a ketogenic diet, because as you can imagine, taking off carbohydrates out of the regular diet is very hard, especially in Italy, where we eat a lot of pasta, bread, pizza, it's very hard. So we developed some items, some food that can be used in substitution to the regular food, regular grains, and we can still have that type of taste, but we didn't have to you didn't have to get rid of bread or pasta or Nutella, chocolate. We can still have it. So I've been also publishing a lot of social videos, like to inform people what the benefits of ketosis might be in regular life. Because, the big problem is that most people don't know about it. So I've been also publishing a couple of reviews discussing about the possible beneficial therapeutic effects of ketosis. You can find them on PubMed. And also, this is the line of ketogenic products that we've been discussing with the Ministry of Health, and now we have an approval, so we can distribute this food, at least in Italy, with the National Health System for epileptic patients, with GLUT1 deficiency patients, and in some cases also with other neurological disease patients. Talking about cancer, I just want to show you a few very important, crucial study cases that I've been dealing with personally. We have Marco, 63 years old. He was diagnosed with prostate cancer. He was put on a 3-to-1 ketogenic diet, and his prostate-specific antigen went in 2 months, just 2 months on a ketogenic diet. It went down from 1.62 to below 1. He's been on a ketogenic diet for over 2 years now, and this PSA never went up 1. He never did radiotherapy, and his PET scan after 2 years on a ketogenic diet revealed no evidence of cancer recurrence. We have many cases, but I'm going to show you just the most significant ones. Mario, 66 years old, with pancreatic cancer, put on a 4-to-1 ketogenic diet, so a very strict ketogenic diet. His cancer antigen went from 43.69 units to 9.84 units in only 6 months. He's been over 2.5 years on a ketogenic diet. His PET scan reveals no evidence of cancer recurrence. Again, a second high-grade lesion, another cancer, put on a 4-to-1 ketogenic diet, 9 months on a diet, and there is a consistent reduction of glial lesions, tumor mass, and edema. Another case of cancer, but it's a different type of cancer, of stage 4 colon adenocarcinoma, put on a very strict ketogenic diet for 1 year and 3 months. Well, his computerized axial tomography revealed that there is a consistent reduction of lesions, of cancer lesions. Then there is Luca, who has glycogenosis. He was on a ketogenic diet for a mild ketogenic diet, and he was able to go back to work after a few months and exercising. He didn't have any spasm or pain anymore. And this is a very important case of glioblastoma multiforme. As you probably know, this is one of the most aggressive brain cancers. And brain cancers are very responsive to carbohydrate depletion, because brain can work on a high amount of carbohydrates. So when we take this off the regular diet, brain cancers are the most responsive ones. So this person, Giancarlo, was put on a 4-to-1 ketogenic diet, and after 8 months, there was no evidence of tumor growth. Just very quickly, just to let you know that in our country, in Italy, we have several courses on ketogenic therapy. Especially Professor Tagliabue organizes every year a new course. This is a very old slide, but every year she teaches new dietitians how to use ketogenic diet therapeutic ketosis on patients. And last but not least, I just want to go to the last point of this presentation. Parkinson's disease is at the moment one of the least studied pathologies for ketogenic therapy. Specifically, there are few papers I'm going to show you here that all say one thing, that ketogenic diet and beta-hydroxybutyrate, which is one of the 3 main ketone bodies, has a very important action against the neurotoxin MPTP, which is one of the most responsible, the highest responsible of the Parkinson's disease advancement. See, this is another paper that pretty much says the same thing, that beta-hydroxybutyrate is a very important element against the advancement caused by MPTP neurotoxin. And again, another paper by Vanilli that says the same thing, that beta-hydroxybutyrate might have some beneficial effects. So in collaboration with some colleagues, we actually have been studying, this is an ongoing study. So we are right now studying these patients on stage 1 Parkinson patients. We've been working with Dr. Charimboli, Vardara, and Matarazzo, as you can see in this picture, working on analyzing their speaking ability, some patients' speaking abilities, facial expressions, tremor, posture, rigidity, leg agility, and also their capability of sitting or standing up. Specifically, we've been analyzing their autonomic dysfunction, troubles in sleep, neuropsychiatric disturbances, and the respiratory troubles, the way they fall, their pain, because they feel a lot of pain. And notably, we've been using the G-Walk test, time up and go, and the 10-meter walking test to give you an idea. I'm going to show you a quick video on what we did. Then we also did some neurocognitive tests on these patients, analyzing their minor mental state, their memory, their frontal functions, like their way of speaking, the phonemic fluency, the semantic fluency, the way of learning and remembering when they have learned. This is just an example of what we did. Just going to show you a quick video. This is a test memory, actually, a test for allowing them to see a picture and remember what they've saw, and then to put all the frames together. This is a memory test that is very important for Parkinson's patients. So they have to see all those frames and remember where they're allocated. So the patient actually has to select one of this. Then the data can be analyzed and put through a computer, and then the data is collected. Data are collected. So the objective in 3 months, so we are month 1, we still have 2 months to go, is to understand what is the ketogenic diet impact on cognitive performances, on cognitive decline, on their motor conditions, and on their non-motor conditions. This paper from March 2018 is a very important article from a New Zealand study that found out that on a randomized 47-patient study, of whom only 44 commenced to die, but actually 38 completed the study, there was, after a ketogenic diet for 2 months, there was a decrease in urinary problems, in pain, they felt no fatigue, they didn't have any daytime sleepiness anymore, and especially, most importantly, they didn't have any cognitive impairment, or actually their cognitive impairment decreased. Also, with this article, Dr. Phillips and his team demonstrated that a ketogenic diet is safe, is definitely safe to use for all purposes. Also for Parkinson's patients. Actually, the ketogenic diet showed greater improvements in non-motor symptoms rather than in motor symptoms. But the important thing is that all these benefits were found. And in our study, even if it's just 1 month long, and I will still need 2 months to go, we have found that there is a significant increase in urinary problems so far. So these are some of the initiatives that we do for Parkinson's patients in our area. We are very sensitive. We actually try to involve them in a lot of activities. And our next step is to create a supplement that is able to allow Parkinson's patients to have it and to be in ketosis, so to have this neuroprotection by ketosis without following ketogenic diet, which might be hard for most of them. Last but not least, I want to briefly introduce you the Italian Glucose Deficiency Association, through which we monitor the patient's outcome that follow a ketogenic diet. We organize conferences now, a lot of webinars. Also, there is this platform, there is for very useful for rare disease patients, rareconnect.org, through which we connect people that might have the same rare disease to fight against that disease together. Also, I've been working with this amazing Dr. Cosimina Cusano, with a number of pathologies like ALS, mitochondrial encephalopathy, pancreatic cancer, epilepsy, autism, glioblastoma, obese people. We have a lot of people in treatment. And before the end of my presentation, I want to submit to your attention a few movies that might help you understand what ketosis is. The first one is Fed Up. It's an amazing movie that I really find very interesting. You can find it on YouTube or even on Google. You can find some extract of this movie. I don't want to show you the whole trailer because this would take too long. This is the second movie, That's Sugar Film. This is from Australia. This actually helps understanding what a high carbohydrate diet might cause to any individual, how detrimental this can be. This is another movie from the United States, Magic Pill, September 2017. I strongly suggest you to watch this movie. And this other homemade movie made me smile at first, but then actually made me understand a lot of things. This is a very homemade movie that will let us understand how butter, even butter, the fattest of nutrients, can help us lose weight. I strongly suggest you to look at these movies. And then I want to thank you, all my partners and these exogenous Ketone conferences participants, and all my lab fellows. Thank you very much for your attention. And if you have any questions, please feel free to ask. Thank you very much.
Thank you so much, Dr. Raffaele. It was really good research. I have a question. Might this ketone work for people with